I can confirm that we've gone live now.
Thank you.
Thank you very much. So welcome to this remote meeting of the Surrey Local Outbreak Engagement Board. This meeting is live for public viewing via the live stream on the Council's website. Please can I remind all participants of the remote meeting etiquette as below. So the meeting etiquette is the Chairman's camera will be on at all times. Please only turn your camera and microphone on when you wish to speak so that we can maintain the call quality. If your broadband connection is poor and is affecting the quality of the call, then consider turning off your camera and only using the microphone to speak. Please use the chat function or the raise hand button to indicate that you do wish to speak, and a member of Democratic Services will give you a thumbs up to acknowledge your request. The meeting will be recorded by Democratic Services and will be minuted by the committee manager. Please note that comments in the chat will not be minuted. I would also like to inform members and viewers that in the event of disruption to the live broadcast due to technical issues, the meeting will be suspended until the issue has been resolved. Thank you. So now on to the business of the meeting. So item 1 is apologies for absence. I know that we've received apologies from Councillor Stuart Sellock. Amelia, are there any more apologies?
Hello, Chairman. No, there have been no further apologies that have been.
Thank you. So the next item is the minutes of the previous meeting that was held on the 25th of September 2020. Can I ask colleagues if we are in agreement to the minutes of the previous meeting?
Agreed.
Agreed. Thank you. So we now move on to item 3, which is declarations of interest. Does any member have a declaration of interest in respect of any item to be considered at this meeting today? Thank you. I'll take silence as no declarations. Thank you. So if we now move on to item 4, which is questions and petitions. We have received 6 questions in total. These questions have been tabled in the order of receipt, and each questioner can ask just one supplementary question relating to their original question in order. If we could please refer to the first question submitted by Teresa Wood, and responses have been tabled to the questions and circulated. Could I ask you, Teresa, do you have any supplementary questions?
Yes, I do. Yeah, I do.
Could I ask you to please go ahead? Thank you.
Thank you for the information regarding the specificity of the ANOVA lateral flow test. While specificity seems good, the sensitivity of the test is far from adequate for use as a rapid mass detection test, with a BMJ article dated 17th of November stating that false positives from the ANOVA test are estimated at almost 2/3 of the positive tests detected. Isn't it time that local governments started to question the policies that are expected to administer on behalf of a government that doesn't seem to be able to understand the reports and data well enough to make considered and rational decisions?
Thank you, Teresa, for your supplementary question. Can I please ask the relevant officer to respond?
I'm happy to come in there. Thank you for the really good question, Teresa. And board colleagues will see that we, in the original answer, we detailed the report of the Public Health England evaluation that looked at all the evidence. And as you say, although the specificity is high, that report didn't detail the sensitivity. So I know that's not your question. I'm sure you can appreciate both sensitivity and specificities of tests depend on a lot of factors as well as how they're administered. And as you quite rightly say, at the moment, the government policy and the guidance is that, and very recent, is to use these tests. They've been used for the people who work in acute trusts to test twice a week members of staff to see look at their status, but also, which is very, very, very new, and has been piloted in Liverpool, and that they're not quite finished their first 2 weeks, and in Stoke-on-Trent, to test asymptomatic members of the population. But local authorities are being encouraged, as you point out, this is policy, are being encouraged to start to test asymptomatic members of the population. Now, that hasn't happened in the South East as yet, but we're starting to look at what that process will look like. But yes, there's an issue. We all need to be mindful of the sensitivity and specificities of the test. But at the moment, we're working towards the Public Health England guidance, which also influences national policy.
Am I allowed to speak again or not?
Thank you, Teresa. The brief is that there's one supplementary question. If you would like to take that dialogue up with, maybe I could suggest Ruth offline, I could most definitely put you in contact. If you could perhaps provide Amelia with your email address, or Amelia may have that, and I will link you up. Thank you.
Thank you, Chairman. I'm happy to liaise with Teresa.
Thank you.
Okay,
Is Candy Sampson here, please?
Hi, Chairman. I don't believe she's on the call, so that indicates that she does not wish to ask a supplementary, so we can move on to the next public speaker.
Thank you. So that's Stuart Robertson. Could I ask you, Stuart, do you have a supplementary question?
Yes. Yes,
Please
can you hear me? Okay.
Yes, please go ahead. Thank you.
Thank you for your supplying the information in response to my question. It fully supports the inaccuracy of the PCR testing and confirms that false positives will lead to making unnecessarily damaging policy decisions. Why, as a local outbreak emergency board, do you continue to support this kind of testing in the full knowledge that it will lead to healthy people and their contacts unnecessarily self-isolating, therefore taking invaluable resource from our society and compounding the devastation caused by the misinformed and dangerous response to this virus?
Thank you, Stuart. That's a really interesting question. I'm going to defer that to the relevant officer. Thank you.
Thank you for your question, and I think in my initial response, and I'm happy to take this up in more detail after the meeting, will be to refer colleagues to the second paragraph of our response, outlining the evidence that shows a 95% sensitivity and specificity, and therefore the really important role of testing, especially in test and trace, so that we acknowledge, yes, there is a chance that we'll be finding false positives and some people have to self-isolate, but for the vast majority of people who get a positive test and self-isolating it, they are doing it to protect the rest of the population and to prevent further spread. As I said, I'm happy to have further conversations with you after the meeting.
Can I just say in 2 seconds, 5% could count for every single test being false positive? The level of testing, but I'll do it offline.
I think there has been an offer to do that, Mr. Robertson, so thank you very much. If we now move on to Mr. Thomas Walker, do you have a supplementary question, please?
Yes, I do. Good afternoon. My thanks to the board. I had previously inquired as to some of the economic harm invoked by the lockdown. I note, based on the materials provided, that we saw a 13% of those surveyed had seen negative impact on household income. 56% had negatively impact in terms of employment. We've seen a 277% increase in claimants of universal credit. And that's in addition to 20% of ineligible employments being put on furlough. We've seen nationally this has contributed to a 20% collapse in GDP, which is 10 times the worst quarter of the 2008 recession. And with public sector debt now over 2 trillion, that's 2 million pounds. How will the board advise local council adapt to these devastating financial difficulties, will the board suggest the need for public sector pay reductions or redundancies, or will local services need to be reduced? Thank you.
Thank you very much, Mr. Walker. I'm wondering if that question is quite broad in terms of the issues that you're raising. And I would suggest, if you are happy with this, that we provide you with a written response. Thank you. Unless there's an officer here or member of the board who would like to respond. Okay, we'll go with a written response. Thank you. So is Mr. Philip Walker here, please?
Yes, good afternoon.
Good afternoon, Mr. Walker. Do you have a supplementary question?
I do, yes. So the written response that I received seemed to imply that it's very likely that on leaving national lockdown and re-entering the tiered system, tier 1 is likely either to be beefed up or tier 2 will be the presumed baseline. I'm just wondering what the hypothetical data would have to look like locally for a tier of restrictions not to apply. So what is the ceiling for that first baseline of restrictions being applied in the first place in terms of hospitalizations or cases per 100,000 or that sort of thing? Thank you.
Thank you, Mr. Walker. Ruth, would you like to provide a response to that question?
I think our Chief Exec is going to come in and respond to that one. Happy to. Joanna, you on the line?
Thank you.
Chair, I was just going to offer a supplementary, which is at this point, we're not aware of any of the thresholds or sort of data points that the government will use to make this determination. Clearly, we may be able to have discussions about that, but at this point, there is no understanding yet of the determination, the nature of any new sort of revisions to the tier levels.
Thank you very much. Final question is from Mr. Duncan White. Mr. White, do you have a supplementary question?
Yes, I do.
Please go ahead.
Thank you. Thank you for your initial response to my inquiry concerning the transfer of patients from NHS hospitals to nursing and care homes. And it's fair to say that the Council has taken measures to expand expenditure on such issues. But the question remains, has the Council taken measures to expand capacity in either step down or nursing and care homes to avoid the problems that were encountered in March and April with the premature discharge of vulnerable patients to care homes from NHS hospitals? And I ask this because it's very clear from your response that the local authority has committed an extraordinary amount of money to the structure of avoiding a repetition of this unfortunate situation in March and April. But I cannot determine from your response whether there has been a revision of the processes that can assure that there are better outcomes from the lessons learned from that period. And this is important because chucking money at the situation without revising the structures and the processes is going to land us up in exactly the same position we were before, when with the NHS gets to shove, comes to push, patients will have to go somewhere, and we could land up in repeating the errors from March and April. I would be very interested to know what measures the local authority has adopted over and above chucking cash at the situation.
Yeah, Chair, I'm happy to take that question.
That's great, Avril. I was going to pass this one on to you anyway, so thank you very much.
Thank you. I'm Avril Mayhew, one of the area directors in adult social care. And Mr. White, thank you for raising this. It's certainly a question that we've all reflected on since wave one of the pandemic. And what we are doing is working hard with our health colleagues that work with us on hospital discharge to really think about whether residential or nursing care is the right destination for people coming out of hospital. So we are certainly encouraging our own social care staff to challenge any decisions where we don't think it's the right thing. Obviously, we want people to be in their own homes and to go home directly from hospital if that's possible. But we do have step-down facilities for people who need a little bit more time to recover from their illness before they go home. And equally, we're working extremely hard with our domiciliary care providers and our living care providers to ensure that they have got capacity to be able to manage people when they do come home from hospital. So I agree that the first response was it had to be that way at the time, but now we've learned a lot from that and are certainly changing our practice to ensure that people can go home if at all possible and where it's safe to do so.
It would be interesting to know what those revised procedures are, but I guess that's a supplementary to the supplementary.
It is, yes, and I'm happy to take that offline with you if that's helpful.
That would be very helpful.
Okay, thanks.
Well, thank you very much. So I'd like to take this opportunity to thank everybody who submitted their questions. It's really important that members of the public do challenge us and do ask us questions for points of clarification. So thank you very much for those really interesting and broad questions. And I'll be sure to make sure those supplementary questions are picked up offline. So thank you. You're very welcome to continue on the meeting or you can leave if you so wish. Thank you. So we now move on to item 5 on the agenda, which is the COVID-19 surveillance update. If I could please ask Dr. Rachel Gill to pick this up. Thank you.
Sure. Hello. I'm just going to share the slides. Great, hopefully you can see the slides. So hello, my name is Rachel Gill. I'm a consultant in public health at Surrey County Council. So I'm going to take you through the COVID surveillance update. So I'm going to cover the COVID-19 daily dashboard, which we publish on a daily basis, and the COVID-19 intelligence report, which we publish twice a week, and then talk a bit about the daily data monitoring and surveillance that we undertake in the public health team. So this slide shows our daily data dashboard. The bar chart shows the number of cases of COVID a day. The blue bars indicate a 7-day period ending on the 15th of November. So reporting delays mean that data can be incomplete for the most recent days. Therefore, the data shown is the last 7 days of complete data. And we've seen 1,936 new cases in Surrey in the 7-day period ending the 15th of November, which gives a rate of 161.8 per 100,000 population. And this compares to a rate of 184 in the southeast and 266.5 in England. So let me just, so Surrey has a lower rate than both the southeast and England. And over a 7-day period, we've generally seen an increase in absolute numbers of COVID cases across Surrey. However, there's been a decrease in absolute numbers in Mole Valley and Guildford, indicated here by the green arrows. Oh, sorry. There we go. So we publish an intelligence report twice a week and every Monday and Thursday. And this is published on the Surrey County Council website and is public facing. The web address can be seen on this slide. So we share the data with a wide range of partners, including health and district and borough councils. And the intelligence summary includes data describing the national context, COVID cases in Surrey down to district and borough level, hospital activity and the regional R number. And there's also links to further data sources which are publicly available should you wish to explore the data yourself. The national data pages include a function to include your postcode and view data at a very local level. So it's hopefully the user-friendly guide at the end will be useful. We also publish a twice weekly intelligence report, which we update on a Monday and a Thursday. The report includes COVID rates down to the district and borough level compared to Surrey, the South East and England. As you can see from this extract, Surrey ranks 98 out of all councils across England with a rate of 145.5 per 100,000 population in the 7 days ending the 16th of November. So this compares to rates ranging from 450 to 675 in the top 10 areas in the UK, or actually in England. So within Surrey, the rates range from 106.9 in Waverley to 220.3 in Runnymede, and that's the rate per 100,000 population in the 7 days ending the 16th of November. So this slide illustrates the age-specific case rate as a heat map. So the darker the colour, the higher the rates, and therefore you can see the 16 to 29 age range have the highest rates, and this is a spreading across the age groups, with the darker colour slowly increasing as you go across the age groups. And this mirrors a picture that we've seen nationally, with the cases spreading up across age groups and starting to now reach the over 60s. So this slide shows the number of cases in 14 days up to the 16th of November in each district and borough. The darker the shade of blue, the higher the number of cases. And the cases have ranged from 245 in Mill Valley to 445 in Spelthorne. So there's been a change in the geographical allocation of cases, which has had an impact on our COVID data. So Public Health England updated the method by which the location of people who test positive or negative for COVID is recorded. Previously, the address was taken from the person's NHS summary care record and therefore would use data at which a person was registered at a GP practice. But PHE now prioritises the address given at the point of testing. So this obviously should reflect better the geographical distribution of cases, especially in the cases of students who may still be registered with their home GP rather than their one at university. And this change has been applied retrospectively back to the 1st of September. And as a result, case numbers from the 1st of September onwards have changed across our local authority. And the table on the right-hand side shows the impact that we've seen in Surrey. So there's been a reduction of around 4% of cumulative cases, and there's more notably a decrease in around 9% of cumulative cases in Elmbridge and 8% in Waverley. So that's the end of my presentation. I'm happy to take any questions.
So thank you very much, Rachel. Colleagues on the board, if I could ask, does anybody have any questions that they would like to ask? I can't see any seconds. Do we have any hands up? Oh, sorry, Mr. Walker.
Thank you. Do you have the number of positive cases against the number of tests carried out?
Yes, so we do look at the positivity rate. So that would be the number of people that test positive out of the number of people that were tested. We do have that data, and that's one of the indicators that we monitor on a daily basis.
Okay, it just wasn't anywhere in the slides. So.
Yeah, there's a wealth of data that we have access to and that we include also within our daily data overview, as well as the twice weekly update. And there's a wealth of data that you can get hold of nationally as well, with the links that are at the end of our surveillance report. Yeah, there's a wealth of data which is really helpful to be able to access.
Thank you.
Thank you. Councillor Lewis.
Thank you, Chair. I just wanted to make a comment about the presentation of the data. Bearing in mind this is a local outbreak engagement board, I think that the dashboards are very clear, and obviously providing them on a daily basis has been acknowledged by the public as a good service. I saw that on the first day that we put out the dashboard, 35,000 people liked it on Twitter, 20,000 on Facebook, and we're getting 8,000 hits a day. So as the task that we're given is about engagement and making sure that the public feel informed, I just wanted to recognise the clarity of the way this is being presented and the fact that it's being appreciated by the public. And I think the fact that we've had people today asking some very detailed and serious questions shows that we're really enabling people to get to the bottom of this, and I think that shows that we're fulfilling the role that we've given with public engagement. So I just wanted to acknowledge that for your team, Rachel, but also for the comms people who are getting it into the right places. Thanks very much.
Thank you, Councillor Lewis.
Thank you. And Louise Punter. Thank you.
Yeah, this may be an academic question really, but I have been faced with quite a lot of people who were shocked with the Elmbridge going into tier 2 before the general shutdown. And I had a lot of people asking questions about where the data, where people were put back. Was it the address that they took the test, or was it their doctors, and that whole question. This is the first time I've actually heard that the data has now been changed. My question, I suppose, is would it have made a difference? And I'm not sure whether that's helpful. It's just that, obviously that was a massive thing for businesses to be sort of closed or not able, or they weren't sort of receiving many visitors at the time that they were in tier 2. So just really an academic question.
No, sure. And we were made aware of this issue actually at the time, and there was only a 14% difference actually at that time when we reviewed it. So it wouldn't have made a difference on the decision about the local alert level. But it is very good now that has been recognised nationally, and the data has now been retrospectively amended. So hopefully that answers your question.
Thank you very much. Thank you, Rachel. I think we don't have any further questions. So I'd like to thank you very much for the presentation, and we're now going to move on. Oh, we have some recommendations, sorry, before we do move on. So if I could just draw board members' attention to the recommendations in the report. Can I ask if those recommendations are agreed? And if I could take silence as agreement, that would be okay. Excellent, thank you very much. So we'll now move on to item 6, which is the COVID-19 Local Outbreak Control Plan update. And I'm going to turn to Gail to lead on this, Gail Hughes. Thank you.
Thank you, Chair. I think it's myself, and I'm going to start off with giving an update on local contact tracing, and then we'll hand over to others for other sections if that's okay. Hopefully colleagues can see the slides. Yep, good, thank you. So just to start off on it, hopefully everyone on the board has read the paper, but just an update on local contact tracing. By way of background, everyone will be aware that since May, anybody in the country, in England, who receives a positive test result is automatically placed into the national contact tracing system, and they're contacted by the system in order to ensure that their contacts are contacted so that they self-isolate and follow the guidance that's available by Public Health England. That's on the gov.uk website. And in order to be effective, SAGE recommends that over 80% of positive cases are reached. So what has happened up and down the country, that 80%, to be frank, hasn't really materialised. And you'll see on the final point here, but in Surrey, it is about in the late 70s to 80% of people in Surrey who do receive a positive test do pick up the phone when they're phoned by the National Service. However, in other parts of the country, this has been quite low, even down to about 40%. So in those parts of the country, Blackburn and Darwin was one of the first. They set up what's called a local tracing partnership. However, there's an expectation now, and quite rightly, that all areas have one of these local partnerships so we can supplement the national work. So even though in Surrey 80% of our residents do engage with the National Service, we're just about to set up a service so that we can follow up those 20% that don't. And so it is what it says on the slide under local tracing partnerships, where local authorities have been asked to supplement this service by contact tracing only those positive cases that the national system hasn't been able to reach within set time scales. So for us, this will be 24 hours. So we are aiming to go live on the 26th of November. We have a go live meeting just so that we can early next week, so we can check that we've got everything in place. And this will be for phase 1. So those districts and boroughs that are what we could describe as touch London and has the higher rates that Rachel's just described, but we hope within a very, very short time scale of a few weeks that will be going live for the whole county. It's really, really important to emphasise that no one's missing out here as such, because the national service will still remain even when we go live with our service. It's going to be delivered by the Surrey County Council Customer Services team, who've been working really hard the last few weeks since we've been directed to have this service to be trained according to Public Health England's guidance. And of course, they'll be supported by the public health team at the County Council, because we do anticipate there will be some complex cases. Yes, there's a script to follow, but invariably there'll be some complexity with some of the cases. And the community helpline staff are also receiving training if there's a surge. We have had the data through. We roughly know the expected numbers of calls, but of course some days it'll be busier than others. This, in essence, will be a phone-based service. So if someone hasn't been contacted or hasn't been reached by the national service, they'll get a text or an email via Gov to say that you'll receive a phone call. And it's really important, and this is what we've been working hard to achieve, that this will be a local geographical number, because the evidence base says that people are apparently more likely to pick up the phone when it's a local number. A voicemail message will be left if the person doesn't pick up the phone. When eventually contact is made, there's a set questionnaire that will be carried out in order to establish an individual's contacts. Now, with national lockdown, people are not going very far. Their contacts are likely to be reduced, but we estimate under normal circumstances it takes up to an hour for individuals to walk through those contacts. And of course, everyone leads slightly different lives, go to different workplaces, etc. So that does vary. And of course, we've been advised, and we're aware of colleagues who've set up this service earlier, that we do invariably get a lot of welfare issues. And that's an absolutely key and fundamental part of this, so that we can catch those issues and work with the individual who's calling. And of course, the board will be aware that for those that need it and are eligible, there is financial assistance if someone needs to self-isolate. So it's very much a telephone-based service at the moment. Other areas, some have converted this into a door knocking service, so we have the potential to do that in the future. Communications for this one is nuanced, I think is the best way to describe it, because we're not asking anyone to necessarily change. What we're asking them to do is ideally engage with the national service, because as soon as contacts of a positive case are reached, the better. But we will do some soft communications around the fact that we will have a local service as well, and you'll be phoned by a local number if you don't pick up the phone to the national number. And so there'll be a set of FAQs that we'll put on our website to supplement that. And also, just to reassure the board on the second and third bullet points, as you can imagine, this has got very tight information governance wrapped around it. And so we've had to work very closely based on national frameworks, in particular working with our districts and boroughs, and most of these are signed off now, so that when we're trying to reach people, we can see if there's alternative phone numbers. And this is where other areas have had really great success in increasing their percentage contact. And where we've gone ahead with all our data process impact assessments, etc., and how we're going to, who's been able to access the data. And as you can imagine, there's lots of good practice to be shared, because we're not the first on this, so we're part of a network, so we share processes and learning. So thank you, Chair. That's the headlines for the local contract tracing service.
Thank you very much, Ruth. We've got a couple of questions for you, if that's okay. So if I could first turn to Andrew Lloyd.
Yeah, thank you very much, Chair. Just a couple of questions, if I may. First, I just wanted to understand whether we would have had an option of going for personal visits rather than telephone contact. Mindful of some of the controversy there's been about the effectiveness of telephone tracing nationally, and if it had been done locally, is that not something that could be done in partnership with districts and boroughs? The other question was that there's been a lot of controversy as well nationally about the idea that only being able to make contact with the positive case, with the infected person, when there are other people in the household that could usefully be perhaps spoken to at the same time to avoid any future duplication. My third point was on this, again, a lot of criticism nationally about scripted information, that sometimes following a very detailed script becomes very inflexible. And I know I've spoken personally to one or two people who've been contacted in other areas, and they found it quite frustrating. They've wanted to ask a question, but they've just been taken back to the script, and they've been left feeling really quite frustrated. So those are my points. Thank you, Chair.
I'll start with the third one and then work upwards. So on the detailed script, the training is quite intense. We're working with, and the reason why we're working with our customer services centres is because the individuals who work in those centres are very experienced and trained in working with members of the public and sometimes quite sensitive issues. So we're incorporating those skills, but the training for this is 10 hours long. Rachel on this call has undergone the training, and my understanding is that there's a certain degree of flexibility now when we get to a local level, because there's that understanding, oh, you live in Sunbury, do you? That's I know, and we can incorporate that. Whereas when you get through to a national line, with the best will in the world and the best training, you just don't have that flexibility. So that's the beauty, I think, of being able to provide this supplementary service. But yes, there's a balance to be struck, isn't there? Your second point about other people in the household. Now that's absolutely key, because of course anyone who lives in the same building, whether they're a family member or whatever, is a contact. So they are definitely will be on the list of people who are told to self-isolate. Is your point about actually it's worth having a conversation with them? Yes. I might defer to Rachel on that point, and what the training is, I think, really guides to the positive case at first. But as we know, if there's a positive case in the household, it's quite likely that there'll be another positive case quite soon. Rachel, I don't know if you wanted to come in on that point.
Sure. So I think that although we're planning the service as via the telephone initially, I think that learning from elsewhere is that the door knocking approach has really helped them to increase uptake in getting cases to do that contact tracing. So that's definitely something that we will look to develop further as the service model develops. So yeah, it's definitely something that we will take learning from elsewhere in order to to develop that local offer.
If I may, Chair, the other point of my question was why the decision was made. I'm not saying it's wrong, but why the decision was made to go for a telephone approach rather than to go for a contact approach, knowing how much better that can be in other areas, or maybe a hybrid of the two to test both.
Yeah, so I think that having a local number has been found to be to increase the success rate, and so it was thought that let's roll it out as a service via the telephone, and we will be continually reviewing the success rate of the telephone service, and we'll obviously then consider whether to extend that service offer and have that combined approach that has been used elsewhere.
We do have that flexibility, so once we get going, we can see what our success rate is and quite quickly adapt if we feel it's necessary.
Okay, thank you very much.
That's really good to hear. The flexibility is built in. You've raised a really good point, Andrew, so thank you. Next I have Karen Brimacombe. Thank you.
Thank you, Chairman. My question, Ruth, was about the building on Andrew's question, really, but not about household contacts, but about other contacts. and why we're not able to use our service to try and contact them, because I would have thought contacts are harder to get in touch with for PHE or for the central service rather than the person who's actually been positive in the first place. But I don't know if that's true. That's only a guess.
So do you mean, so once someone who's got a positive test is called, and then they're asked who they've been contacted with in the past few days, and then all those contacts are contacted?
Yes.
What's your...
So we're not, are we, I took from your presentation that we had no role in contacting them.
So again, that's part of the contact tracing service. So those contacts will be contacted to say, please self-isolate.
But what I mean was, we're helping out because they struggle to get in touch with people, and I would have thought we would have been more successful in actually trying to contact the secondary contacts.
So that's where the current framework is, that those get passed back to the national service. You know, we could probably share, and it might be useful for the board, summaries of the process and the flow charts. That might be it was too detailed to give in the presentation, so there's a clear understanding of what this looks like when we go live. I think that would be really useful for the board to outline exactly that.
Okay, thank you.
Thank you.
Thank you, Karen. Thank you, Ruth. That would be really useful. Thank you. David Munro, who I think may have just very briefly exited the meeting. So we've got Charlotte, please. Thank you.
Thank you, Chair. Ruth, I think you probably offering to share a bit more detail around the pathway may well mitigate my question, but my question was around, clearly you must have done some modelling around the expected numbers of people that you're going to have to contact, and I suspect that is why you're trying the telephone approach first, because clearly you resource-wise you'd be able to contact far more successfully or far more that way rather than knocking on doors. I just wondered, further on in your report, you're going to start talking about your COVID champions and your COVID marshals. I wondered whether we had thought in that pathway how we might use those in the further either failed attempts or where you're talking about requiring to provide additional support to people when you do finally get through to them.
So that's absolutely key, and where other areas use the door knocking, let's call it that model, that's what they've done is most other areas, rather than using, say, council employed. So that's one model, or that they've worked with their COVID champions. It does require an intensive training over and above the initial training that they've had of COVID champion, as you can imagine, safeguarding, etc., etc., etc. So this is layered, shall we say, is one of the better word. But there are examples. I think it was Sinead, was it Stokes, that have done that. But what we couldn't do is roll out, for example, our spellphone COVID champions immediately because there need to be extra training. But it is feasible.
Sure. And are we using our social prescribers in this contact tracing process?
Not at the moment, because in essence, the contact tracers who've been through the 10 hours training are those that are have gone, as I say, gone through the training, got the certificate, so to speak, and the key issue here is to have access to the data, i.e. people's name, positivity status and telephone number, and that's quite bound by all the IG, and they're on what's called the CTAS system.
Okay, thank you.
Thank you very much. So I think that concludes the questions, Ruth, for your paper. So we're now going to move on to an update on COVID champions. But before we do move on to Spelthorne Borough Council, who very kindly joined us to update us, I would just like to make a very brief statement. So after the last few months, we have all witnessed the outstanding work of our public health teams in making sure that Surrey remains resilient and well-resourced to deal with the challenges that COVID-19 brings. But we know, given the rise in misinformation and apathy, that there is a shifting and sadly waning confidence in some public institutions and maybe public service at large. As such, we have seen a real need in this pandemic to empower our constituents to own key public health information, verifying this in the social space and through the sharing of key advice with family and friends in order to support wider efforts to depress incident levels. This is why, when incidences rose to worrying levels in Spelthorne back in late August 2020, the highest in the county at that time, I worked closely with Public Health to bring about this new style of thinking and working with the public to our county. Whilst I would have loved for Surrey to have been the first in developing work in this field, I am very grateful for the excellent work done by pioneering authorities, the City of Birmingham and the London Borough of Newham. Centrally, their COVID Champion scheme, which we owe much to, not only created a network of active citizens who disseminated key guidance from public health, but also crafted a real-time sounding board which helped shape the public health approach of these local authorities in keeping residents and workers safe. Through their efforts, both local authorities have provided us with a great roadmap and excellent practice, which we are emulating and reaping these benefits. Already we have seen schemes backed by the county emerge in Spelthorne, Elmbridge, and this week, Reigate and Banstead. And while it would be unfair to say these schemes alone cause for lower incidences, what we do know is when part of a wider package of public health interventions, COVID Champion schemes ensure that messaging is trusted. This serves to reassure residents and bolster confidence in our teams, who continue to work hard to make sure that we come out of this pandemic. In a moment, I will invite colleagues from Spelthorne Borough Council, which has run the first county-led scheme, to briefly share some of their experiences and their early successes that this model is reaping there. But before I do that, I want to take this opportunity to encourage other districts and boroughs to work with me in public health in establishing this invaluable scheme in your local area. While we initially sought to utilise this measure to help bring cases down in Spelthorne, we need not wait until we hit peaks before acting. As such, I hope that after listening to experiences and successes in Spelthorne, that my colleagues and friends across the county will move with pace to ensure that we become a county of COVID champions. Thank you. So I'd now like to move to Deborah Ashman from Spelthorne Borough Council. Can I ask if Deborah's here?
Yes, I am.
Thank you, Deborah. I believe you have a presentation for the board. If I could ask you to please go ahead. Thank you.
I'm going to pass it over to Councillor Moyne Attewell, who's our deputy leader and who led on this politically, so from Spelthorne's point of view. So she's going to actually do the presentation, if that's okay.
Councillor Attewell, thank you.
Sorry, just getting my camera on. Are we going to put up our PowerPoint slides? Deborah?
Oh, sorry, Surrey have it. We've transferred it to Surrey. I believe that their administration are putting it up.
Hi, Deborah. I've not been sent those. So if
Yes.
you could put those up.
They were sent today to Gail. I'll put up the. Do you want to just go through rather than the PowerPoints, Maureen? Could you just go through the talk rather than?
Yes, of course. I was just waiting for you to finish, and I was going to say I can do that. Well, the first point we sort of think, what did we do? To start with, we were absolutely delighted when, due to Spelthorne having gone onto the government's watch list, that Councillor Mooney suggested that we be the first borough in Surrey to launch the scheme. Initially, we researched how other schemes had been operated in London and beyond, and we then created an information pack which included details about the role of the volunteer, field a recruitment video, created an online form for champions to register their details, and a privacy notice to inform champions how we would use their data. Public Health Surrey created a short training video on COVID-19 for champions to watch and understand more about the virus. We've put together a welcome pack, which includes information on good practice and a code of conduct. Working with county colleagues, we create a weekly information briefing sheet, which covers 5 points, including Spelthorne specific, national Spelthorne specifics and national updates, and a rotating theme of what to do to look after ourselves and others. And of course, we are open to anything else you may wish to add to that. So we're very positive about running the scheme. Following other councils, we hold weekly virtual meetings with council officers, your public health officers and champions. The information sheet is sent out to champions 24 hours before the meeting, and champions are invited to join the meeting and to ask any questions, clarify guidance, raise concerns and discuss good practice. Who did we approach? Learning from other boroughs, we decided to adopt a targeted approach to encourage people to join the Champion scheme. We want to ensure that all our communities across Spelthorne were represented, as well as all population groups. We especially wanted to ensure that groups most at risk of becoming seriously ill with COVID-19 were included. And for example, we included older people, our deprived areas, and Black and minority ethnic groups. We have representatives that include councillors, staff members who are residents and active in their own communities, members from food banks, local businesses, charities, including those working with families, carers, working with older people, and also residents' associations and faith leaders. Challenges we've faced. We're extremely proud to be the first borough in Surrey to launch the scheme, and we worked quickly to ensure that the scheme was launched within a few weeks of having been approached. We've sought feedback from a small number of champions to help us develop the weekly information briefing. Champions feel it's a very informative document, but are mindful of information overload, so we're making sure to keep the information informative but concise. Champions, as you would expect, have really appreciated the Spelthorne specific information, and we ensure that this is relevant, local and any new information included. The aim being to ensure champions feel special and that they are the first to hear certain updates, with a view to seeking to encourage them to become and then remain champions, because we want to keep them as interested as we can. We are experiencing challenges. Still under challenges, sorry. We're experiencing some IT issues with people joining the meetings, not experienced to join in virtual meetings. Finding a suitable time for everyone has been a challenge, so we're investigating recording the meetings. Ideally, champions are email questions beforehand, are asked to email questions beforehand, but there are always some issues that arise on the day. And I wanted to particularly thank your public health colleagues attending the meetings. This has been very well received by the champions, and we have found this to be invaluable. As often questions are asked that they are best placed to answer, but a particular thank you to Councillor Mooney and to your colleagues in public health. They've been extremely helpful. It's worked very well. I don't know if anybody's got any questions they'd like to ask.
Thank you, Councillor Attewell. Before we move on to questions, I'd like to thank you for that very thorough update. I'd also like, having been actively involved within this scheme, I'd also like to thank Deborah Ashman and Mary Holdaway, officers at Spelthorne, and Jen Smith and our public health team and her colleagues for picking this up with real pace and real momentum and a real enthusiasm and passion for making COVID champions a reality here in the county of Surrey. So I'd really like to thank you for that. I'm just going to open it up to questions now, and we have Charlotte. Thank you.
Thank you, Chair. Hi, Maureen. I'm Charlotte Kenneth. I'm actually a GP in Spelthorpe.
Yes, so. I know you are, Charlotte. Yes.
And this sounds brilliant. I guess it's not really a question. It's an offer. How can health as a stakeholder help support the programme? Because I noticed you have public health in your stakeholder list, but actually as a GP, I'm cited on it because obviously in my other role, but I don't know that any of the other GPs in Spelthorne would be cited on this fantastic programme. And for example, our PPGs, our patient participation groups,
yes.
Is there any way we could extend the knowledge of it for you in health?
I did think about the social prescribers, of course, appointed to the local practices. So we could think about that. And I'd ask Deborah if she has any ideas, what she thinks she could add to that. Deborah.
Hi. I think certainly at the moment, we've been very specific at the moment because it's been running for 3 weeks. And we're trying to, as we say, incorporate lots of very active local members of the community. But absolutely, I think the more people that we can have with the more specialism, the best it is. So I'm more than happy to contact Sunbury, which is my local GP anyway. So I'm more than happy to see if we can get more people to join us from health. That would be brilliant. I mean, to be honest, the more we have, because not everyone has to actually join the weekly meetings. It can just be that we share the information, and then if people want to join us or want to have questions, we do follow up the questions that are sent to us on the weekly meetings, so they do get responses in writing further on during that week. So you don't have to attend the weekly meeting. Yeah. But absolutely, I mean, we'd be anyone that can assist in this, obviously really good cause, and we're more than happy to pursue, and I'll certainly follow that through from our side.
Yeah, I think, Deborah, it was the offer to be part of the dissemination of information so that people know this exists, and also perhaps feed out the information further just to make it wider. I didn't intend to push us onto you as in terms of yet another person that you have to have in your meetings, but we'd be more than happy to share in how we spread the information that the champions are spreading. You know, posters. I know people aren't coming through GP surgeries in the same way, but we've got websites, we've got Facebook, we've got all of our local routes, which and we were used quite heavily in that first Spelthorne outbreak to try and help send messages as well. So happy to help in whatever way.
Oh, thank you, Charlotte.
A really good offer, thank you. So I have another question from Mark Brunt, Councillor Mark Brunt. Thank you.
Thank you, Sinead, and thank you to Maureen and the team at Spelthorne. And as the leader of Reigate and Banstead, this has been something that we've been wanting to do for quite a while. I've been nagging Sinead about this for quite a while because I think this is a great opportunity, and I've seen this in my own community, where the trust of authorities of all sorts of sizes and types is not always universal, and where those existing groups where people have trust, they're more likely to take information from, say, in in my particular area, our community development workers, our faith leaders, our community group leaders. They're more likely to go to them to ask them the questions. If we can get them the information, those community leaders, those faith leaders, the information at hand, so when the questions come to them, they can respond. That helps to get those key messages out to our community. It's very easy for us sitting here on this type of meeting to feel that social media or virtual meetings is a really effective way, but for a lot of our members of our community, particularly our more socially isolated members of our communities, those are not very accessible. So the scheme that we've launched in Reigate and Banstead is very similar to Spelthorne, and again we see this as an opportunity for the future. post-COVID. So these are more community champions that in the future will also be able to get some of these critical messages, whether that's about the services and support that's available to them, or just what's going on in their communities. Because I think we all want to make our communities more vibrant, more self-sufficient, as we've seen come out of this COVID outbreak. So I think this is not just about COVID. This is about communities going forward. And I'm very grateful for all the support that we've had from Surrey and also from Spelthorne and Elmbridge in terms of the learning of the lessons that you've gone through. So thank you for your support, and we're behind. We're not as advanced as you guys are, but we hope to be at the same level you are very, very shortly.
Thank you, Mark.
Excellent. Thank you, Mark. So we've got Andrew Lloyd who has a question.
Thank you. Just a couple of very brief comments and then a very, very short question. The first one, I guess, is that it's fantastic to see the enthusiasm and the pride which Councillor Atwell obviously has for the system. What you've achieved in a short time is truly very, very impressive. And like Councillor Brunt, I think that the use of community champions can be so useful in so many different ways. In my past career in local government, when we had an issue with integrating the Nepalese into our community, we used community champions so effectively then to deal with disinformation, to get real facts out to real people that they trusted, and that was really helpful. And I was also very impressed that the strong partnership again between Surrey and a district in doing this, and that makes such a difference when the two tiers work together so effectively as is clearly happening. My question was just a very simple one really, and that was, have you been able to measure the effectiveness at all? Have you had much feedback that gives you confidence that this is working in the way that you hoped?
I believe we have from the champions themselves. I'm keeping an eye out in the community on social media to see where this information is popping up, as I'm sure Councillor Mooney will herself, being an expert she is on social media. But I think it's early days as well. We're just into our third week, but we'd be very pleased to share any information we have that can be shared with the other boroughs, of course, because we're all in this together.
Sorry, it's Deborah Ashman again. Could I just say that the one thing that was really positive that because we've been breaking it down in wards, that's made a massive difference. Because if you're speaking to a particular resident or resident association or something, say for instance in our area in Stanwell and Ashford, for instance, are particularly high, and it's quite unbelievable. Sorry, my phone keeps ringing. It's quite unbelievable, the effect that's had, because that has gone out into the community really quickly, and we've already started hearing feedback from that. So I can say that yes, I think we're also having that immediate. Because of the people like the food banks, we're speaking to the food. We've got the food banks as representative as COVID champions. So yeah, we already within those 3 weeks, as Maureen said, has really made a difference. So we have already seen that impact.
Thank you. So I think there's probably no more questions or comments to the team from Spelthorne. I'd just like to. Before I move on to Adam Letts, who wants to say a few words, I'd just like, at the end of the questions, just like to extend my personal thanks and gratitude to Councillor Atwell, who has really been the driving force at Spelthorne Borough Council for this scheme to take off. And without her commitment and understanding of the COVID champions, I don't think it would have been as rolled out as quickly and effectively as it has. So personal thanks to you on that, Maureen. Thank you. If I could please move to Adam Letts in Public Health for the final words on COVID champions. Thank you.
Thanks very much. Yeah, I'd like to reflect our thanks both to Councillor Mooney and Councillor Atwell as well for your statements and for recognising the work in other areas and for the call to action across Surrey. All of the points have been incredibly valid, particularly some of the opportunities as well post-COVID and making more self-sufficient communities. That sounds really, really positive. So I'm Adam. I work in the public health team in Surrey County Council. I'm one of the team that lead on the work in the COVID Champions scheme. And just to briefly supplement the information already outlined, which hopefully answers some of the questions too, the COVID Champions scheme is voluntary. But it's about engaging the trusted local people and community leaders who can be the voice for those around them. It's intended to complement the other measures and communications that are in place already by further empowering the communities to better help themselves. And this essentially is going to be district and borough led, but with the technical support to facilitate managing the programme at local level. Thank you.
Thank you, Adam. Thanks ever so much. So I think we'll now move on to our next bullet point, which is the COVID-19 marshals. So I'm going to turn to Jess Lira. Thank you, Jess.
Thank you, Chair. This is just a quick update for the group on COVID marshals. So I'm Jess Lira. I support the emergency planning at 6 of our boroughs. But going to give this update on behalf of all districts and boroughs. So as we know, Boris announced the sort of scheme for COVID marshals back in the summer, and this guidance came through to district and boroughs. It was part of the compliance and enforcement. So district and boroughs obviously assessed what was needed on the ground, what would help and what was needed. Through that, there is a varied amount of work going on, so it's very different. So some aren't actually called COVID marshals. There's a few different names, but in essence what they're doing is supporting obviously our very busy environmental health staff. So it's worked really well. It's around getting that intelligence from the ground, going out, using the police's method of the 4 E's, so the engage, explain and encourage. Okay, their role isn't to enforce. They're about supporting businesses with the guidance, looking where possibly there isn't compliance, and then what can we do to solve that, and then obviously then working very closely with the environmental health teams who may go in, and obviously with the police as well, who share some of those enforcement actions. So there's a varied, some have recruited straight into their environmental health teams, some are using, so Epsom and York, for example, actually were the first people to take up the scheme. So they introduced them back in June, actually, when the town centres were first opening up, and yet they used some of their theatre staff. So very much is working well. It's about supporting businesses and the community. But thank you. If there's any questions on that.
Thank you, Jess. That's really useful. We've got two questions so far from David Munro, then Charlotte. David.
Thanks very much, Chairman. I've just got one question on that. It all sounds very positive. I just want to confirm that our police borough commanders are in full touch with the COVID marshals in each district. The police do need to know where they are at all times if they're out and about for obvious reasons. And we do have the opportunity of dovetailing the two organisations at a local level together. You mentioned the 4 E's: encourage, explain, educate, and in the last resort, enforce. Well, that's exactly what we're doing in Surrey Police, and so we need to work together. I'm sure we are, but I just wanted to raise the point anyway.
Thank you. Yeah, I know a lot of the boroughs are having weekly meetings with their borough inspectors. So yes, definitely it's a partnership working.
Thank you very much.
Thank you. Charlotte.
Thanks, Chair. Hi, Jessica. This may already be happening, but I just wonder, given the very recent developments around our COVID mass vaccination, are your COVID-19 marshals linked into the conversations around the use of premises for COVID mass vaccination in Surrey?
So that's been done slightly separately within the councils. So I know there are points of contacts within the district and boroughs who are looking at sites. So the marshals tend to be very much out on the ground. So a lot of them are in town centres, business areas. So they're not at particular premises. Done through, I know the district and boroughs are engaged with that process, just not through the COVID marshal route.
It just might be an idea to think about joining those conversations up, given where some of the sites potentially may be.
I think Councillor Attwell.
Thank you, Chair. I just wanted to reassure Charlotte really that we've been quite active in identifying possible sites and obviously will continue to do so. Thank you.
Thank you. So that's great, Jess. Thank you very much for that positive and enthusiastic update on the COVID-19 marshals. I'm sure the board will continue to keep an eye on the progress of that, so thank you. I'm now going to move, I'm conscious of time, colleagues, I'm going to move to Avril Mayhew, Area Director in Adult Social Care, to cover care homes and winter pressures. Avril.
Hello, thank you, Chair. Yes, so I've been asked on behalf of our Adult Social Care Leadership team to give the board an update in two areas, that's care homes and winter pressures. So firstly, in terms of care homes, it was touched on earlier, but we have, as other local authorities have, been given an infection control grant, which we have issued to our care homes. There have been two rounds of that grant, first one in the summer to the tune of 13.7 million and a further grant envelope of 15.8 million, which is with us now between October and December. And so 62% of the grant will be ring-fenced for care homes specifically and will be allocated on a per-bed basis. The rest of the grant can be used flexibly to support other care providers. The types of support that are the types of things that the money can be used for is around, for example, staffing to ensure that staff are fully paid when they are isolating for whatever reason, or, for example, supply alternatives to public transport to ensure staff can get to and from work safely with minimal risk of infection. Other things like perhaps accommodating staff in a hotel if they didn't wish to be with their families. So that's currently being provided. More generally on infection control support, training on infection control has been rolled out across all of our 410 care homes, and this has been done obviously in partnership with our health colleagues. That's been a mixture of face-to-face training and demonstrations around use of PPE, how to don and doff, etc., as well as online information, support, webinars, etc. And additionally, all care homes should now have a named care coordinator, which has been coordinated via the primary care networks. In relation to PPE, the national portal has now been extended to provide free COVID-related PPE for the majority of care homes and other social care providers. But locally, there are emergency supplies that care homes can access via our local resilience forum should the supply chain, for whatever reason, fail and urgent PPE is required. There's been some new guidance from the Department of Health and Social Care around designated settings. And this requires care homes to seek further CQC approval if they are to accept people from hospital who have a COVID positive status. We are currently working with our care providers to identify potential providers who wish to come forward. The uptake so far has been quite low, so we're also working with our health colleagues to ensure that there are alternative pathways for people coming out of hospital, because clearly we don't want to cause any bottlenecks for our delays in our hospital system. Visitors to care homes, you'll probably be aware that there was new guidance released earlier this month, which encourages and supports care homes now to facilitate safe visiting opportunities for families and loved ones. So, for example, that could be floor-to-ceiling screens, pods, window visits, tests for family members. So we have been working with our care providers directly to ensure that they have received the updated guidance, and they can obviously access support and advice via our public health colleagues as needed. And finally, in terms of care homes, in relation to testing itself, all care homes should now be able to get tests via the national portal, and that's to fulfil the requirements of weekly testing for staff and monthly testing for their residents. I'll move on to winter pressures and then hopefully take questions after that. So we've already mentioned hospital discharge, and this will be a winter like no other with the usual pressures as well as the COVID surge. So there are new, again, national requirements that we've been putting in place. It's called Discharge to Assess. And so from the 1st of September, anyone being discharged from hospital will receive up to 6 weeks of care and support that's funded by the NHS. And during that period, it's expected that we in social care and with health colleagues will complete assessments of those people to determine what type of care they need on an ongoing basis and what the funding arrangements will be. In relation to winter pressures in the care market, we're working really hard with our providers to ensure there's enough capacity, both in terms of home-based care and in residential and nursing care, so that we can cope with the normal winter demand as well as the COVID surge. And finally, on winter pressures, a note about flu vaccinations. We are encouraging all our own Surrey County Council staff in social care as well as staff in the wider independent social care sector to make sure that they have a vaccine, and we are monitoring the uptake of that. Thank you.
Well, thank you very much, Avril. I think you've provided actually in your update some real reassurance, I think, for board members and generally members of the public, particularly around the close working that's going on with our partners. I think that's incredibly reassuring. And I'm also personally very much reassured to note that we have a stock of emergency PPE. I think as we really are now starting to come into the winter season, and as you say, this is very unique circumstances, winter for us, that's so important. So thank you for your update. We have a question or a comment, I think, from David Munro. David.
Thank you very much, Chairman. I'm sorry if this was covered before when I had to leave the meeting or it be covered later, but I've not heard anything about pressures on hospitals. Regrettably, we know from wave 1 that an increase in infection leads to an increase in hospital admissions with a time lag, and indeed to deaths also with a time lag. Could we be reassured that there are plans in place to handle that?
Yes, so there are obviously each of the acute trusts along with their health partners have daily, weekly escalation arrangements to ensure that any surge or bed capacity is quickly addressed. Obviously, there's been a lot of planning ahead of winter, as there always would be, but additional planning in relation to surge. Obviously the data is collected in terms of numbers of beds available, numbers of admissions and numbers in ITU, as well as numbers of COVID positive patients, and that's shared regularly amongst the ICPs and system partners. Does that answer your question?
I think it does, and you have reassured us that Surrey can cope.
Yes, I mean, we are as actively as involved and anticipating and planning as best we can.
Thank you, Avril, and thank you, David. We have a kind offer from Sue, who's here to comment from the acute trust position. Sue, we'd be very grateful to hear from you. Thank you.
Thank you, Chair. Just a brief comment, and happy to pick up with David outside of the meeting if he would be interested. But as the Chair of the Royal Surrey Foundation Trust, I would just comment that during the first wave of the pandemic, the Royal Surrey did build a new 20-bed isolation ward, which allows us to cope with COVID patients much better than we did before. And that ward is in full use now. One of our chiefs of service has particularly taken on responsibility for COVID patients, and our experience thus far is that we've had far fewer patients as inpatients in this second wave to date. and also far fewer patients needing treatment in intensive care. And we have a board meeting next week. Every month now, our public board papers do cover a COVID update, and Ed David or any other member of this board or members of the public who wish to can access the COVID reports every month on our public website.
Well, could I say thank you very much indeed. I don't need to talk privately at all. No, this is a public meeting, and it's right that the public therefore can be reassured, as I hope they are now, that notwithstanding the gravity of the situation, that there are plans in place, capacity plans and so on, and as I said before, that the county can cope.
Thank you very much, David. That's a really good point, and I'm so pleased that you raised it. Hopefully, as you say, we've received some reassurance, but I think it's something as a board we perhaps keep an eye on at future meetings, most definitely. So thank you for that, and thank you, Sue. Colleagues, I'm very conscious of time. We have some recommendations. If I could ask you to consider those recommendations, particularly item 4, which is to approve the local tracing partnership launch date of the 26th of November 2020, and also equally important, or more important perhaps, is to ensure that as members of this board that we continue to cascade information within our organisations and our areas of influence. We've heard a lot today so far. Can I ask board members if you agree with the recommendations?
Agreed.
Agreed.
Thank you very
much. Agreed.
Thank you. Okay, we now move on to item 7, which is the local outbreak control communications plan update. And I'm going to refer to Abby Pope, please, Senior Communications Manager for this update.
Yeah, hi everyone. I'm standing in for Andrea today as she's unable to be here. I'm just going to share my screen. I've got slides and I'm conscious that there's 5 minutes until the end of the meeting, so I will whiz through as quickly as I can. Apologies everyone. Just waiting for it to come up. Just waiting for it to load. Right, can you see my PowerPoint slides now?
Yes.
Yes. Thank you. Right. So obviously everything looks quite different to the last outbreak engagement meeting. As you all know, we've been in a period of national restrictions since the 5th of November, so we've had to completely pivot in communications and have developed a number of new campaigns to help support our Surrey residents during these 4 weeks. This is the first campaign, which is tailored national restrictions assets. Hasn't just been online and social media. We've been providing special tailored assets to our district and borough colleagues in any format that they wanted. We've also had them in targeted train stations that are particularly busy in the digital screen format. So they focus on, you should only be travelling for essential reasons, stay at home, and what to do if you've got symptoms. In terms of our social media, and purely because this is the easy one to evaluate, we have obviously reached a large number of our population. It's over 1 million impressions, which is the number of times the promoted posts have been served up to Surrey residents on their social media feeds. And the percentage of available Surrey residents that we've reached is 45% based on Facebook's estimated audience size for Surrey. I'm hoping that you can see this GIF. Is it moving? Can you see it? Yeah, okay. Yes, so this is another campaign. We've been very conscious, particularly due to the weekly behavioural insights report that we get from our Cabinet Office colleagues, that, as we all know, people are starting to feel a bit fatigued by the continued restrictions, and they are feeling very much that they're missing out on milestones, particularly the younger parts of our population. So this was a behaviour change campaign where we wanted to sort of motivate people to keep going, to promise them that there is light at the end of the tunnel, hopefully in 2021. It's focused on things like festivals that we know from the younger members of our team that they really felt keenly that they'd missed out on this summer. Also things like football matches. We did this lovely one which was based on Diwali, which was received really well, and we'll also be doing one to look forward to Christmas. This is just I can skip over this, but it's just an idea of the reach of this, which was about 842,000. It had an engagement rate of 2.3%, which it sounds low, but in terms of social media, that's actually a really decent engagement rate. This was another campaign that we did just to get really simple communications out there to let our residents know which services were open and which were closed. And as some of that information was quite nuanced, it linked to Surrey County Council website. And then below there is the Be Ready and Think Ahead assets, which is really about supporting our community to be self-sufficient and to plan ahead. So if you are going to be asked to isolate, giving some tips about how you might ask friends and family to support you, thinking ahead to how you might get food in for 14 days or even potentially medicines. Just a quick sort of note that Nextdoor is becoming a really successful channel for us. It's got really high community engagement, and it reaches a very large proportion of our population. Over 154,000 of them are on our Nextdoor account, and we've had lots of thank yous from residents. The Diwali post was particularly popular. Actually, we had 241 thank yous, which is actually really quite impressive. So moving on to our big success during the national restrictions, we came up with this idea with the support of the public health team to present the data in a very bite-sized, accessible way daily, so that residents are able to see how our infection rates are tracking. They can immediately look up their own district and borough and get an idea of where their rates are. This has been incredibly successful. We've got this out through all of our channels, through the MIG, the Multi-Agency Information Group, and people are constantly giving us really positive feedback. Apparently schools in particular have been they've been enjoying this because they find it a really kind of accessible way to explain to pupils what's happening with the infection rates in the surrounding area. So this has had a huge engagement rate of over 20%. 1,000, nearly 1,500 people have have clicked the link and gone through to more of the surveillance data, which is available on our website, and over 7,000, nearly 8,000 engagements just on one day. This is, I won't go through this, but this is just another idea of how successful it was on Nextdoor. It seems to be getting, interestingly, sort of progressively more successful, and more people are engaging with it as the days go on, so that by Wednesday this week we had 165 people thanking us for it, and over nearly 66,000 people had seen it. These are just a few positive comments, because it's always nice to see that people are looking at our communications and finding it useful. Lots of positive comments, and then there was a lady in Spelthorne who was a bit concerned that it was the R rate, which was it was actually the rate per 100,000, which was over 200. But what's lovely is that the community comes together. People replied and explained to her exactly what the rate meant. And it's just nice to see that our residents are really engaged with the data. They're starting to educate themselves, and they're really understanding what this means for Surrey. So in terms of further activity, so Ruth, our Director of Public Health, who has spoken earlier, is doing a weekly slot on BBC Surrey, and this is another really great way of getting the data out. She's been doing a great job of getting all of our important key messages out and letting people know which areas really need to be vigilant. We've been working very closely with colleagues in Mole Valley. We had an incident management team, which is when we mobilise all the relevant people, environmental health, the communications team centrally and in the district and borough, and anyone else who has a sort of interest across the system. And very interestingly, we have seen numbers falling in Mole Valley. We need to do a bit more work looking into exactly why it is that when we specifically focus on an area and take all of these actions, exactly what is happening there and why people are changing their behaviour. And I've just had a meeting with our head of research today to start thinking about a piece of work that might help us understand that and unpick it a bit more. We've reinstated the top lines brief to all of the members, which goes out on a Thursday, just to make sure that members have all of the key messages and important information in case they're asked by their residents. We also, because of the last Outbreak Engagement Board meeting, I know there was a lot of feedback about the how Elmbridge had been escalated to high. So we ran a great lessons learned session with all of our district and borough colleagues. My communications counterpart at Elmbridge gave some really great feedback about what had worked and what could work better. And all of our district and borough colleagues really participated in that session. So I think that, come the end of lockdown, I think we're in a better place to all work together to prepare residents if levels are escalated. We've also produced something called Surrey Together, which will hit people's doorsteps on the, I think it starts being distributed on the 30th of November. It could take up to 2 weeks to get all across Surrey, but it's a hard copy magazine which brings together all of the information on COVID, test and trace, public health messages in terms of flu and looking after yourself, and including some of that sort of self-sufficiency messaging. Also areas like the hidden harms that we know have occurred during the lockdowns in terms of domestic abuse and all sorts of things. So that is hitting people's doorsteps very soon. And we are also going to be producing a easy read version of that, which we can use with our sort of Surrey Minority Ethnic Forum, because they've asked for easy read versions, and also the Gypsy and Roma traveller communities. So we've got a huge amount of things coming up, which I would just touch on. Obviously, we are supporting the public health team, working with them closely on the locally supported contact tracing. Ruth already has outlined what we're doing in terms of communication on that. We will be supporting and working with our NHS colleagues on the mass vaccination programme, which we are all sort of coming together with, on in the MIG, which is the Multi-Agency Information Group. So we will do anything we can to help them. We, in the meantime, will be working on mass testing when we know what that's going to look like. And very, very top of my mind is what happens in terms of our exit strategy from the current national restrictions, which finish, as we all know, on the 2nd of December. I just had to come out of a meeting to join this meeting, actually, where the Department of Health communications team were about to give a update on that. So as soon as this finishes, I will be back on the phone to them to find out more. But obviously, we're really hoping that we get that information as soon as possible next week, so that we have adequate time to prepare residents as to what the world might look like after the 2nd of December.
Great.
Sorry for racing through. I just didn't want to keep all of you for longer than necessary.
Sure. Thank you very much, Abby. Really appreciate that update. And there's so much positive work, I think, going on in the communications aspect of the work that we do in regards to COVID. Really strong messaging. David, I know you have your hand up. Could I ask you, please, due to time, to be very, very quick and concise?
Yes, indeed. I agree with all that. It's very encouraging, but I would like to have a mention of enforcement as well. The vast majority of Surrey people will respond positively to positive things. There's no doubt about that. We have a small minority, in my view, that will not. And we need to remind people that, this is serious stuff, and the police will be there to enforce the law.
Yeah, absolutely. And we work closely with Jay Butcher. He sits on the MIG, and we meet once a week. So we are absolutely supportive of any messaging that he would like us to share with residents.
Thank you.
That's great. I think I saw a further hand go up from Councillor Lewis.
Thank you, Chair. I wanted to thank you very much for the creativity of everything you've been doing, which I appreciate and hope the residents do too. Thank you also for having a bit of an investigation into how well we had prepared people for the possibility that Elmbridge would end up in Tier 2. So I suppose, and I had raised that at the last meeting. So I suppose in a way my question's a bit of a repeat. I do love the positivity of the 2021 stuff, but it's possible that the beginning of 2021 isn't going to be that much fun. How are we preparing people for that? Because, you know, we could be back here again.
Yeah, it's a tricky one, isn't it? And we're very conscious that we have the mass testing and mass vaccination stuff almost, you know, like two freight trains rumbling down the tracks towards us. So I think once those programs are embedded and we know where we are on the communications of that, then I think we probably move on to the next stage. But it's really hard. It's like, you know, needing to look into a crystal ball, really, isn't it, in terms of how we can prepare residents for things that we don't know yet ourselves. So we are very conscious of that, and I think it's just that campaign was particularly just about, you know, not just about giving people hope, but also reminding them that if they want things to get back to the, you know, the way they were and do the things they love, then they actually do have to comply and they do have to follow the guidelines.
Thank you.
That's great. Thank you very much, Abby. If I could turn to colleagues, we are asked to note the activity outlined in the report. If I could take silence as agreement to that recommendation. Thank you. Okay.
Agreed. Sorry.
Thank you very much. So I think that takes us to the last point of the meeting, which is the date of the next meeting. And that will be taking place on the 18th of February 2021. So I'd like to take this opportunity to thank all of you for joining the meeting and your really positive contributions, and I look forward to seeing you soon. Thank you very much. Bye-bye.
Thank you.